Hello and welcome to today's Power of Knowing webinar, Thriving Under Pressure, How to Manage Stress as a Caregiver. Understanding comes from knowing. Caregiving can be quite challenging. Thriving Under Pressure is a three-part webinar series that will explore the many facets of caregiving. Today's part one of the series will discuss ways caregivers can recognize and manage stress this important role can bring, empowering the caregiver to be their best for those they are providing care for. The Power of Knowing is a free webinar series created by AuthoriCare Collective, a nonprofit organization that empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome our moderator, Risa Hanau. Risa serves as clinical and community educator at AuthoriCare Collective and is also a member of the Cone Health Ethics Committee. She is a licensed clinical social worker. Risa, I turn it over to you.
Thank you, Paul. And it is my pleasure to welcome our panelist for today, Pete Barusic. Pete has over 3 decades of experience as a physical therapist. He is dedicated to enhancing the physical well-being of others across various settings, including rehabilitation, private practice, and home health care. Pete has had the true privilege of making a direct impact on countless patients' lives. And then in 2023, his journey took a profound change as he transitioned to become a certified life coach and founded In Between Seasons Coaching. This shift in his life's journey was inspired by personal caregiver experiences, including supporting his parents, providing in-home care for a family friend during her end-of-life journey, and assisting his wife during her battle with breast cancer. These experiences underscored for Pete the importance of having holistic support systems in place and the necessity of comprehensive approaches to well-being for caregivers. He draws upon his experience as a healthcare provider and also as a caregiver. Pete is deeply passionate about having dialogue and equipping caregivers with practical tools to navigate that role with resilience. Thank you for being with us today. We are going to have a wonderful conversation. And as we think about the beginning of our conversation, we'd like to know a little bit about who is joining us. So we have a polling question, and it is multiple choice. We know that you may be a patient and a caregiver and an advocate. So please check all that apply to you. This is an anonymous poll. It's up on your Zoom screen. So if you take a moment to respond, we'll get to see who is joining us and in particular, how many caregivers we have with us today. We know so many of us are in that role. So we'll go ahead and see what the results are with that. Wow, 79% of people on this call identify as a caregiver, and another 38 as advocates, and large percentage of healthcare professionals and human service professionals and spiritual care guides. So thank you so much for participating in that. And I think, Pete, this sort of emphasizes why this conversation is important. We want to hear from you. We also want to hear from those of you joining us. You can make use of the Q&A area on your Zoom screen at any time to enter a question, and we will do our best to answer them during the time together. So Pete, when we think about your transition from being a therapist and now a life coach with a lot of caregiving in there, I know you've developed a way of viewing, some steps really to think about how caregivers can take care of themselves or might approach their role. And we're going to talk about them. And they include having an awareness of what's going on. It includes how we actively listen to ourselves and to others. It has to do about acceptance of this role and what does that mean? And then also about making choices and what's in our control maybe and how we respond. And I know for caregivers, sometimes we don't focus on ourselves, but we focus on those that we are caring for. So why don't we start and talk to us about awareness as a caregiver?
Mm-hmm. Thank you, Risa, and thanks for the opportunity to do this. Yeah, I found out, like I said, I've been a physical therapist for 30 years, and I found that maybe I was not giving the best advice to people as I was going through until I was actually thrust into those healthcare storms. So I had to come to a realization that really through some hard knocks learning that maybe my perspective and some of the things that I was educating people on, I was not following myself as well. Some of the good things I was giving, I was not following. And in February 2022, quick story is my mother, who lives in a different state, ended up having some complications to back surgery, and I ended up taking family leave and going up there. And I came in with an awareness that I needed to get everything done. I'm only here for 3.5 weeks. I became part of the 23% of the population that has taken family leave to care for a family member, and I was only going to be there for 3 weeks. So I came in on fire, getting everything done. So my awareness as I sat back after 3.5 weeks of being in there and leaving where I felt like I was accomplished what I needed to, and then found out that my mother didn't talk to me for about 5 days because she saw some of the things that I cleaned and some of the things that I did. So there's awareness that for me it was guilt. I came in to where I was that son that was out of town. And part of that awareness was, okay, what did I bring to the table? What was I doing as a son and as a caregiver to help her? So that was the first thing, realizing that I own some stress in that environment, that I was the one that was causing some of that. And so I learned from that, which then led to that next one of that active listening. And I call it just using like a curious approach where I actually was able to talk to her and ask her what her feelings were. Because that was one of the things. I made changes to her environment, and not once did I ask her what she needed. And that was where the complication came into, is that by just asking her, she would have made the same decisions that I came to, but it would have been her choice. It would have been her decision. So part of me actively listening would have been to ask her, okay, what do you think we need to do in this situation? Allowing her to have a role in that. So that was those two things, that awareness of what I was bringing to the table, because I was causing a lot of that stress.
Well, and I think, as a caregiver, sometimes it seems that, yes, we might have limited time or it's clear to us what is needed, but the realization that that care recipient, that patient, that loved one might not necessarily be at the same place that we are. So was it your mother not speaking to you that made you slow down and sort of say, maybe I could approach this differently, or oh my goodness, what have I done? Because I think as a caregiver, it can be hard sometimes to know when to push and when to pull back, or how to approach that, and how do we partner?
Yeah, that's the word, partner. I think that's the key to the whole situation. Is it's difficult as a caregiver, especially a family caregiver coming in, and we have history with that other person, and good, bad history. So that, unfortunately, that has a role in to the situation that we're dealing with right now. So part of that is releasing some of those things and really thinking, okay, what are we doing in this moment? What is this moment? How can we partner? So yeah, the the 5 days of her not talking to me, that basically was the hammer, hit the nail. That was basically the thing that really set it off. But I had realized as I had left, as you're going through the situation, that there was an awareness that really I didn't allow her to make these decisions. And really, what do we all want? We want control. So part of being a care partner, it is a mutual conversation. It is not about what I want. It is not completely about what she wants, because there's things that we have to kind of work together on, that to where maybe some of the things that she's not seeing, that's what I'm there for, to help her, to say, Mom, can you really do this the way you used to do it? Things have changed, but we need to have an open dialogue. That's really where it comes down to. If we're not listening to the other party, and I've seen that way too many times as a home care physical therapist. I've sat in the middle of many storms where family members are screaming at each other because no one is listening to the other person. And that's frustrating, and that really limits the opportunities to move forward. So,
right. And I also, I think, given your role as a physical therapist, I would imagine you were perhaps sometimes acting as a physical therapist and sometimes acting as a son. And sometimes our roles get blurred a little bit, and to have some awareness of who am I in this moment? You have skills and expertise to bring, and yet to have that awareness that you were there as a son. And I would imagine as a caregiver, you are still the son, and shifts in relationship because of illness or injury can be challenging, I think, for the caregiver and then for that care partner.
yeah, that was the biggest thing for me, Risa, is that I actually had the opportunity a year later. My mom had another surgery, had complications from that surgery, where I took another 3.5 weeks off. And I came in that second time as son Pete. I didn't come in as physical therapist Pete. I didn't come in as coach Pete. I came in as a son and as a true care partner, and actually actively listening and being there for her. And now I can't say that I completely took off the PT or the coaching hat that I had, but it was definitely way down the line. It was more of me being there and loving on her and trying to be present, and give her more of the emotional support that she needed. But then also with that active listening, when things weren't going well, uh, there would have been a time I would have told her, well, you need to do this and you need to do that. And I changed that completely to, well, okay, I see you struggling with this situation. What can we do maybe a little bit different? Is there another way that we can approach it? How can I help you? Having her take some ownership of that, and then me being there as the person to maybe help implement some of those things, but I allowed her the ability to have that decision making in the process.
And I wonder what that was like for you. What did you do with your feelings? Because you're putting a lot of energy to be attentive to her. You're being thoughtful about the words that you're using. You're being an active listener. You're being curious. But that also isn't always in our nature. That can be exhausting. So I wonder how you then took care of what did you do for you during those times?
Yeah, good question. Thank you. Yeah, it's interesting. One, I will say I had less stress. So I did have less stress.
Mm.
So I feel like I had to have all the answers. But as far as self-care for me was doing what I need to, listening to her, but then maybe separating myself. So for me, I'm a runner. I go for walks. I did those things to try to recharge. For me, just spending some quiet time by myself, and then, actually taking myself out of the situation helped me to be better in the situation. Because, if I'm not in a good place as a caregiver, I'm not going to be able to assist that other person. It's too much of a drain, because I'm bringing energy to the situation that may not be the most productive, and actually will get in the way. And people sense that. My mom could sense if I came in, and just the look sometimes of, okay, what's he going to tell me? What's he going to do? So that took time for us to actually resolve that, to where I was just there to be present for her.
Right. And as you said, it reduced the stress for both of you ultimately. Once you got into that pattern, you didn't have to work as hard and the stress reduced. It doesn't change the illness, the injury, the complication, but the environment was less stressful, it sounds like.
Yeah, huge difference in stress, because now I can say I'm coming in next week and it's not going to be, okay, you're going to clean my house. I've eliminated that, no, it's I'm coming in with the motive to be there and to be present for her and to assist. I think that's the biggest thing of all is there's a mindset as a caregiver sometimes that we need to fix things. And fixing is by far the worst thing that we can do. Assisting is the better word, is what can we do? And I love the word care partner. I like caregiver. I like the word care partner or care advocate. We're there to help guide that other person, but it has to be mutual. It cannot be one over the other.
And so I think that's part of that curiosity or that active listening. And I talk some about, active listening. I sometimes think about the difference between eating and tasting our food, but actually being present. And talk to us about that in terms of being a caregiver, and how do you keep yourself from saying, oh, but wait, no, that's not going to work, and truly sitting and being with someone without having your agenda take over what's going on there.
Yeah, that's an excellent question. I think it's a constant battle. I'd love to say it's easy, but it gets easier over time. And that really comes down to that awareness and then into that active listening component, is really asking open-ended questions. So I am acknowledging, I'm validating what that other person is going through, but I am not, again, making judgment of it. And I think that's the hard part. It's so say, well, really what you just told me, that's probably not the safest thing you need to do. And here's the quick example that may kind of help with this. Is 2 weeks ago I was on the phone with my mother, and she answered the phone, obviously out of breath, and the phone was across the room. She was on her walker. Next thing you know, I hear her fall to the floor. So she fell when I was on the phone, and I can hear her moaning. And so in that moment, my first thing is to assess, okay, is she okay? Activated a phone tree, got my sister-in-law to the house, she's okay. Old Pete would have been, why did you get up and go across the room when you know the phone's over there? And really, I would have taken control of that situation. New Pete, who's in a different state of mind, was, let's talk about that. Glad you're okay. We got past that, but okay, what happened in that situation? You tell me. She told me she got up. She knows she shouldn't have gone across the room. She shouldn't have rushed for the phone. It was an accident. Me reassuring her that it was an accident. Luckily, she was okay. And then we talked about what she can do differently in that next time this happens. But she needed to make that decision, not me make it. Because if it comes down to Pete told me to do this, or my brother told her to do this, or my father told her to do something, it's somebody else telling her what to do. She was able to make that decision of saying, okay, I don't need to rush for that. And so part of that is allowing her to process the situation. So me actually taking myself out of it and just being there with her as emotional support. So as you said, back to the question, it is a struggle. Every day I have that awareness of saying, okay, how am I showing up here? And so part of that is I stop, take a breath, analyze the situation, and then we move forward.
Yeah, we have a question that just came in that was actually going somewhere that I was thinking about. So the question is, wouldn't you think that caregiving for someone that has cognitive abilities or limitations is different than caring for someone that has lost their cognitive abilities? So your mother cognitively is intact, but somebody who has lost their cognitive abilities, diagnosed with dementia, that's my situation, the questioner says. My wife and I are 61, and she was diagnosed with early onset dementia at 58. She currently attends adult daycare during the week. So as I was listening to you, and I appreciate this question greatly because I was thinking you can have that dialogue with your mother, but we know so many caregivers are in a situation where their care partner is not able either partially or totally to engage in that conversation and be a partner in the way that you're able to be with your mother. So maybe just some thoughts when we are the caregiver for somebody with a cognitive limitation.
Yeah, a great question. Thank you for that. Yeah, it's a challenge because it has to be approached differently. And unfortunately, the stats are we have 1 in 4 are caring for someone with dementia or with a cognitive uh, disorder. So it's an issue. And unfortunately, we were there as well last year, cared for someone in our home who had early onset dementia. So that we can have that conversation, but it's more of a challenge. So for that situation is how are we presenting ourselves? Sometimes people tend to push back a little bit more. So we can't really have that conversation where, you can ask something, we may get a different answer every single time, and you may get different energy back every single time. So it comes down to trying to meet them where they're at. And then also there comes a point where we have to realize that we can't do this alone. So having adult daycare, having more assistance in the house, because it can be frustrating. I've talked with many people that have cared for spouses or family members with dementia, and they're exhausted, they're overwhelmed. It's such a strain. So part of it is, sometimes I say we can't go through the front door, we have to go through a window or a back door. So it's reapproaching things multiple times. Again, understanding what our awareness is. When our energy level gets up, when we start to get frustrated, that person senses it. So when we cared for Leona in our house, she was 90 years old, and we're getting to end of life, and didn't really know her real well. But as she was starting to decline cognitively, how we entered that room was huge. What energy I brought into the room. If I came in kind of, I need to get things done, there was pushback, and it was frustrating, and it was frustrating for all of us. But if I came in, put a smile on, maybe if it was dressing that day, maybe we talked about the weather, we talked about something else to try to work our way around to get to where we needed to go. But patience, that's the biggest thing that I can advise. Because it's every day is different. You never know what you're going to get.
Right. And I think the adult daycare is wonderful. I also think about caregiver support groups in
Mm-hmm.
that situation. And sometimes we can't leave the home, but to go to a support group perhaps when the person is at adult daycare, or because as you said, especially with the dementia, it can be a very long trajectory of that role as a caregiver. And it changes over time, which I think is also one of the challenges of, I think I know how to do this or how it will be, but then it's different tomorrow or it's different over time.
Yeah, one of the things I will say, so minimizing distractions, I think that's the other thing I've realized from the 30 years of physical therapy and seeing the rise in the dementia population is when there are a lot of distractions or a lot of things going on around, it's very hard to focus. So we need to minimize a lot of those distractions to where because that person, they can't process all that. That's part of the issue sometimes with someone with dementia is they can't process all the things that are going on around them, and what may be hunger, what may be, just noise, they can't process, and then they act out, or we're going to see some other behaviors. So I think part of that is minimizing just the distraction and then community. So it's hard if you add more people in, that way you take a break. For my wife and I, luckily my wife and I were there, so we took turns. Like we were able to split off some of that, and if something didn't go well when my wife went in, then I came in after and tried a different approach. So part of it is just it's trial and error, unfortunately. And everybody's so different, and the range of where they are in the process of the dementia is huge as well. But then there comes a point where we have to make a decision and say, look, they can't care for themselves by themselves. We need to come in and do what we can, whether that's with help or whether it's with other, adding more people to the equation.
Thank you. And certainly, I'm thinking about the population with a cognitive limitation versus those who do not. And I'm also thinking about the acute illness where I'm a caregiver for, that acute illness, that acute recovery time versus that long. And oftentimes these things mesh and blend. And as you said, we start out thinking it's an acute situation and then it evolves into a longer term. And so it makes me think about your next step, and you title it acceptance. So tell us what you mean, because there's a part of me that says, I don't want to accept this, right? I don't like this. But I'm gathering that's not how you're going to help us understand it as a caregiver.
Yeah, the way I look at acceptance is really an understanding that there are things in our control and there's things out of our control. So if we use this example of somebody with declining cognitive function, there's some things that we can control. So again, let's look at, are there things that are influencing the situation that we can actually improve? Is it environmental? Is there some type of stress going on there, whether it's emotional, physical? Is there something we can change in the equation? We can't change the dementia. We can't change sometimes what other people, even my mother, there are things that I have to accept, that she is in control of her life. And there's certain things that I can encourage, but she ultimately can make the decision on that because that's her choice. So part of that acceptance is accepting the things that we really can't control. Part of the thing with acceptance is if we spend our time trying to change what was or try to change what is, all we're doing is causing more stress and we're not solving anything. We're basically, I call it tunnel vision. We're just looking through a lens of, I can't believe they did this. I can't believe this happened. Where if we can accept, okay, that was the situation. Maybe that's the best we could do in that moment. Now what can we do to move forward? So what are those things that I can accept that we're not going to change?
Yeah. So I'm thinking about sometimes a caregiver is by themselves. They don't have a spouse to partner with, or it's the spouse who is in need of care. Maybe there are not children, or they are not available or involved. But sometimes we have multiple people. So your father and your brother and you. I wonder about, so you might get to a place of being curious, you might get to a place of acceptance, but how do you navigate those others that are in your family by blood, family by choice? How do you keep that? Because I think as a caregiver, it can sometimes be very challenging, either because one person's carrying the burden, or those that you're sharing it with have different perspectives or different views.
Yeah, that is very real. That is probably majority of the families that I have ever dealt with, and majority of the families that I know. I say there's not everybody sitting at the same table. They're in the room, some are at a kid's table, some are off in the other room. They don't always see what's going on. So part of that again comes down to really, I'm going to circle, we go back and forth to awareness, to active listening, to really having these conversations. There needs to be an open dialogue. The way I've seen this work the best and how it's worked for my family is we have conversations and say, okay, this is what I'm seeing with mom. What are you seeing? And then we have that conversation to see, are we in two different places? And then having a conversation, well, this is what I'm seeing, and then explaining why. Well, you tell me more about why. What are you seeing on your side? And is there a way we can meet in the middle? So unfortunately, we all come with life experiences. We all come with belief systems. So even though we grew up in the same household, we don't always agree. On things. So how can we work around that? What are the things that I can accept that, okay, yeah, I'm out of town. My sister's out of town. I have a brother that lives down the street. It's not my brother's responsibility to do everything. So what can we work on together where, okay, you can be there physically, but okay, maybe I need to be there more emotionally. I need to call more often. How can we work as a team? Because this really needs to be a team effort. And that's hard to get buy-in sometimes. I've seen it way too many times where, as I've cared for people, there is one or two family members that just don't want to know. They don't want to be involved because one, I'm sure it's caused some heartache, and whatever baggage that's happened in the past has led to where we are today. But we have to be open and honest. I think that's the biggest thing of all. I think we don't do that all the time. I think this open dialogue, well, they're never going to change. Well, how about let's have a conversation about that and see, maybe they don't really know what's going on. How can we work together? Because ultimately, for us, my mom and dad's health is the most important thing. That's the one thing we should have in common. So how
Mhm.
can we build on that together of saying, okay, what does mom need in this situation? What does dad need in this situation? And how can the three of us work together to accomplish that?
So when you're thinking about as this goes on, I'm thinking about the inherent toll that caregiving can take on someone. So we know that there can be an emotional impact, a physical impact. Talk to us a little bit about some signs and symptoms that our stress is maybe getting to a place where we need to be attending to ourselves, or how it might play out, how we might recognize it.
Yeah, usually what happens when people get under stress, two things really, more than two, but I say two primarily is one, people tend to withdraw. So you just tend to say, I'm going to ignore it. I'm just going to not going to worry about this. It's not my problem. I'm just going to go hide. And then the other side, you see a lot of anger sometimes. So I've seen with family members where it turns into a shouting match, where again, no one's listening to each other. So as we start to get to that point, okay, what do we need to do to move past that, because it's not healthy. It's not healthy to sit in that apathy or victim mode or I can't believe this is happening type of thing to me, or being angry. So it's having a network around you, because it's hard sometimes to do this alone. When we're sitting there, it's having a support group. So joining a caregiver support group or having a network of friends, whether that is uh, people that are not going to go and make things worse. We have those people that just love to get into the drain with you and just start going around and they just make it worse. But finding people that are going to help to just listen, support you, not judge you. And that way we can get out of it. Sometimes it is physical exercise, sometimes it's meditation or prayer. It's finding what it is that works for you that allows you to basically not ignore it, because that's not healthy, but to be able to get into a better physical, emotional, spiritual state, to be able to step back into that situation again in a much better, uh, with much better presence.
Right. And I know that you've had a number of caregiving experiences, and I would guess that each one has been quite different. Maybe tell us some about, you've mentioned your mother, your parents, you mentioned a family friend who came and stayed in your home. When I introduced you, I mentioned your wife's illness. I would imagine you were in a different place as a caregiver in all of those situations. And the reality is, different situations have us respond and react differently. So maybe tell us about the different situations and your response as a caregiver or a care partner.
Yeah, each one of those. So yeah, that takes us to that last one, kind of that choice. How can we respond or react? You know, the first one with my mom, I was definitely reacting. I was not responding. As we move forward to have Leona in our house, and didn't stay earlier than my mother-in-law at the same time. They were with us because of Hurricane Ian. They lost their house, and as we were leaving, my mother-in-law broke her hip. So we had to care for both of them in our house during that time. So I was more in the responding with purpose at that point. It was easier to kind of just go through the situation that way, and to be able to respond. But as we got to my wife this last time, is I had perfected what it meant to be a caregiver at that point. I had 4 experiences over the past 2 years. And so I truly responded with purpose. I was all about what she needed. What did my wife need in that time when she was diagnosed through her mastectomy, through her radiation? And be there for her, to be present, allow her to control where she wanted to go. And, I say in the beginning, she was saying, if it's my time, it's my time. I'm not going to get treatment. So I had to, luckily it didn't get to that point, but she was to the point where, she had to process things. And by allowing her to process things, and for me just to be there and to love her and support her, not judge her no matter what her decisions were, but just to know that I was there for her and to support her, that was truly responding with purpose. That was coming to the point where, okay, what do we need to do? Let's value each breath we have, which I think is important for us anyways, in all situations. Let's value the breath that we have right now. What can we learn in this process? So as we were going through that, both of us saw this as an opportunity for us to, one, to grow closer, one, for us to just learn what we needed to learn at that moment, and then to obviously to be there for those around us. So we're both in healthcare, so we both looked outward at that point of who can we help by this experience that we're going through. But it was truly a responding with purpose and not reacting out of doubt or fear or what's going on or feeling sorry for ourselves. So we made that conscious choice of, okay, how are we going to respond? And part of that is, there's a thing that we could have gotten pretty upset about it. And I won't say we didn't have moments where we're like, okay, why is this happening? But then you get to the point where we stop, you take a breath and say, okay, what emotions are coming up right now? And then, okay, what is this story I'm telling myself in this moment? And then, okay, what can I do about that? What is our opportunity here? So basically looked at it as an opportunity. And I think as caregivers, that's the biggest thing of all, is we look at the stress sometimes, but maybe if we could, it's hard. I know this is going to be a difficult thing, but sometimes taking a step back and saying, okay, what is the opportunity here? What is it that how can I reframe this situation to where we can find some positives? That's the other thing. Let's find positives. We tend to look at the negative a lot of times. So finding the positive in the situation.
So tell me, and I mean this very genuinely, what are the positives in the fact that your mother-in-law fell and broke her hip and remained with you, and then you needed to add her to the list of somebody needing a caregiver? Your wife being diagnosed with breast cancer. How do we do that? I mean, the resilience or how do we turn our mind to that space of the good that could come of it, or the upside?
Yeah. So the situation with my mother-in-law and with Leona, they lost their house in Hurricane Ian. So they didn't have a place to live. So we took them in. And then with her breaking her hip on the way up, it was okay. You take a deep breath, like, seriously, this is what's going on. But it was about, okay, let's enjoy this time together. It was easy to think back on it. It was easy because she had just lost her house. She lost everything she owned. She was in a place where she was hurting. So adding this hip on, she just needed love. She needed guidance. She needed us to be there to support her. So part of looking at the positive is, at that point, she was 88, and we have her now in North Carolina. So that's the positive. So the positive was she would have never moved here to North Carolina. We have her now moving here, lives down the street. I'm actually at her house now. So the positive is now we have that time together. And then the positive with my wife, if we're going to look at a positive with my wife having breast cancer, is that our relationship is so much stronger now than it's ever been before, because we've leaned into every moment we have together is a value. It's a breath. We get going through life that we tend to forget all the little things. We tend not to pay attention to anything. So our positive is every day I have my wife with me, and we have those breaths, and we get to have those experiences. We get to do things together. Despite the breast cancer, that doesn't define, and she says too, it doesn't define who she is. It doesn't define it doesn't define her at all. But we were able to look at it and say, what did we learn out of this? What is our opportunity to be closer now than we ever were before? And all the little stuff that we maybe argued over or disagreed over, they're gone. They're meaningless in the situation. So.
So another question slash comment. So for the person who is caring for someone with a cognitive impairment, and this is from the same person, and really speaking about the loneliness and the social isolation. So being in a situation where you are the primary caregiver, your spouse, the person you're caring for, doesn't have the ability to interact, doesn't have the ability to hold hands and enjoy that music and have that appreciation. And so, they're going to bed very early, not able to engage in conversation. So a lot of time alone, a lot of isolation. And I wonder if you could speak to that aspect of being a caregiver and being socially isolated for many reasons, but particularly you can't leave that person.
Yeah.
You can't leave them. You're alone in some ways while they're awake. You're alone while they're asleep, and that's so stressful, challenging, and difficult.
Yeah, it's a challenge. It's finding community is really the only thing. It is finding a group, whether they have to come to the house, whether it is through a caregiver support group. Luckily with Zoom now, some things can be done over Zoom, but that Zoom is not. This is great, but I think it's the interaction of real life person sitting next to each other, being together. Zoom helps only short, it helps a little bit, but I think finding community where you can get someone to come just be with you, whether it's a family member, whether it's a friend, whether it's someone through a network, through a church, through some other organization of where we need community. So finding someone that can come over, even if it's just once a week, just to spend some time. And then there comes a point, and it's hard with paid struggle right now. That's why all this responsibility is falling on the family members right now. So I would suggest finding some type of support group or some people that you can connect with on a daily basis, if possible, but at least a few times a week.
Right. And I just want to say, Pete, your internet is a little bit unstable, so you're freezing once in a while. So, but I think we're good.
Okay.
So yes, when you talk about community, sometimes it is faith community, and it is true that those relationships, we might not have had them, or we had them as a couple, and then sometimes they fall away, but really trying to find those supports. And somebody has commented, as a caregiver, my life has become so much smaller. And I think that's a very, meaningful word. It is difficult for me to live my life and embrace what I enjoy. Life is about getting my loved one through the day. Do I just grieve that my life isn't broad? And I think that's so real for so many people.
Yeah, unfortunately, that is, we grieve with the loss of someone when they pass away, but we also grieve when there's a change. So I've always said that, in the hospital, they should give us Elizabeth Kubler-Ross's stages of grief, because we go through that, the depression, anger, denial, bargaining, and acceptance. And I think we go through that as a caregiver as things change, because our lives change, their lives change. So again, how can we it's really leaning into finding support because it's difficult to do this role. Um, it's definitely difficult to do it alone. It has been done alone, but I think finding some assistance, and I think our awareness of the stress that caregivers are going under, part of this conversation we're having today is huge. We're starting to have more of that. I don't think we talked about it as much as we need to. We just dealt with it. And I think having us have these conversations and having three parts to this conversation that we're doing with AuthoriCare is, okay, what are those resources now? Yeah, what can we control? What can we not control? Okay, let's look at now, how can we get some assistance out there to get through this? Because we need to do this together. This is not something that we're going to solve individually, not something we're going to solve within an hour's time, but it's something that we have to continue to have this conversation over and over and over again.
Right. And I think about the conscious choice and really thinking about how we react and respond and given permission to feel the way you feel. The sense of grief, certainly, the sense of loss, the sense of this isn't what I expected or I signed up for, or and disappointment, I think sometimes in those that we thought would be there for us. And I think that that is often a part of being a caregiver is you thought your faith community, you thought your neighbors, and sometimes we can feel very disappointed, which adds to that loneliness.
Yeah, I think and that's normal. I think we go through that process. So I think I agree with, and I think Risa for saying that is, I think we have to, it's okay for us to feel that way. I think we've tried to stuff that and try to pretend that everything's okay. And I think being honest with ourselves that we're having that awareness that, yeah, I am struggling, but that's where then we have to reach, okay, what is our choice? We need to ask for help. That's part of it is there's no shame in asking for support and saying, look, I am struggling. Let's be honest, because I've seen too many spouses that are struggling but do not want to ask for help. Like, I'm just going to get through. I just got to deal with this, and that's not healthy for you. And then when something does happen, then everything falls apart because they've been so busy taking care of that other person that they've lost themselves in the process. So it's asking for whatever help that's out there. And I hope through these conversations we will have more resources and we will have more opportunities for people to reach places to reach out.
Right. So thinking about counseling, I think there is the informal, the friend group, the faith community, but then there's also for some people counseling through a faith community. There's counseling through AuthoriCare. There's counseling through maybe a workplace, through an employee assistance program, through various sources looking for that professional counseling when that is appropriate and seeing that as a strength and not as a weakness, which sadly we do. Because if we don't do that, I think, Pete, we are setting ourselves up, and you just alluded to that, of maybe burning out or having our own physical. And talk to us some, because I have to believe you have seen that, probably from the professional side and the personal side.
Yeah, burnout is real. It's tough to think and tough to focus when we're under stress. And that's really where the transition that I felt called to make from physical therapy to life coaching is to address this. So part of uh, what my role and what my goal is to actually to help people on this health and well-being, on their journey, as it relates to caregiving as well, is what are some things that we can look at. So through coaching is saying, okay, here's your situation, not me telling you what to do, but okay, what can we work on to achieve a goal of improving health and well-being? Maybe that is finding a resource or a counselor or something else, or maybe it's finding time to carve out during the day where you can take some time with yourself, whether that is in meditation, prayer, exercise, just able to step away for a second and helping you find those avenues, because I think that's we need to do that. I think we are so busy. We think that we don't have time, but you think about what we fill in our day sometimes with things that really aren't necessary and that aren't serving a purpose. So part of that is how can we figure out what things are causing stress and what things are not causing stress outside of the caregiving situation that really don't need to be there, that we can eliminate. So that's part of that stress is we tend to want to take on more things than we really need to sometimes. So what are those things that we don't need to take on? We don't need to control. We need to let that go. And that way we can be more present with the challenges that it is to be a caregiver, because it's challenging.
Right. And I think giving ourselves permission to care for ourselves can be so difficult, but that, number one, allows us to still care for that person in need of care, but we deserve to care for ourselves and not just to stave off that burnout where we can't do it any longer, but so that we have some fulfillment and we have health and we have, confidence that we are deserving of that.
Yeah. And that's hard. I think most caregivers, it's all about taking care of the other person. They're lost. They're lost in that situation. And the identity of a caregiver sometimes is that other person. And so we need to, as far as caregiver health, we need to take some of that back. And you're right, need to focus, okay, what is it that I need here in this situation that is going to help me to show up better for that other person? Because ultimately, if we're in a better space, physically, emotionally, spiritually, then we can be there for that other person in a much better situation, and we can actually be there for them. And it's healthier. Yeah, there's still stress, but we can manage with it when we're in a better state of mind. And that is work. Unfortunately, it's everyday work. It's not once and okay, I did it and I'm done. It is every day, multiple times a day.
Somebody has provided beautiful insight to their own experience. A father with dementia, and then a mother who was falling multiple times and going back and forth to the hospital. And the father was admitted to a nursing home. And I think oftentimes as a caregiver, sometimes we view that as a failure, or we view that as we didn't do our job. And yet there are times where placement, whether it's in memory care, it's a stay at rehab, as her mother also had, that is absolutely necessary, not only for that patient, that person, but for us as a caregiver. And it's not a failing. It's sometimes not our preference, but it's the reality of what becomes necessary.
Yeah. Yeah. A quick example is that second time my mom was in the hospital, my dad is used to doing everything for my mother. She was in the hospital and rehab for almost 3 weeks, and he spent all his time there. He had pretty much lost his identity. He didn't know what to do. He didn't do anything around the house. He lost the identity of my mother. So that's a real issue. So that finding that and respite, having somebody have them go to respite or to rehab, that's the time to try to recharge, to try to get self in a better place.
Yeah, this person shared that eventually brought both parents home, provided care, but also made use of respite. So
Yeah.
I think as we are coming to the end of our time for today's conversation, Pete, if you could tell us, I am sitting as a caregiver, if you were going to say to me the best advice I could give you before I say goodbye, what do you want us to leave today's conversation with?
I think having an awareness of what we're bringing to that caregiver table, I will say. It's kind of going through, okay, what are the things, maybe some stress that we actually bring to the table, which makes it actually a little bit worse. So I think focusing in a little bit of seeing, okay, what is it that I don't need to, maybe some things I need to accept about myself. So maybe there's some things that I can change and not change even about myself. But having just basically understanding that this is stressful, but the biggest thing is what is the opportunity that we have in this moment with this other person that we can look at and make it positive. So almost like a little bit of a reframing, how can we show up in this situation on a daily basis and find the value in that time that we have together? That's probably the big thing. Is it's easy to look at the negative, but every day, okay, positive. What was positive about today? What are some things that we can reframe? And that is maybe something we learned about ourselves, something we learned about the other person that we didn't really know prior to this. And then what can we do to make tomorrow a better situation to where we can just enjoy each breath we have? I'll leave with a quote, Dr. Seuss, sometimes you'll never know the value of a moment until it becomes a memory. And I think that is so important for us to remember. I look at that quote every single day with all situations that I have. So.
Thank you. Thank you for being a part of this conversation, for starting our Caregiver series. Thank you for those who have joined us today. I hope that you will join us for our next 2 webinars that are coming up. If you registered for today, you're also registered. So in 2 weeks, that will be Thursday, May 23rd, we're going to be welcoming 2 panelists who are going to be able to speak to us about resources that are available in the community. So what should we think about ahead of time when we are a caregiver? What are resources that we can turn to? And then if we have somebody who is in the hospital, what do we think about at that transition time of getting ready for discharge? How do we prepare for that? And then 2 weeks after that, we will on June 6th come together and have 2 panelists who have expertise, many years of caregiving experience, professionally and personally, and really looking at overcoming some of the barriers to accessing resources. We know that not everyone has equal access to resources. Some groups are marginalized, and we want to really focus on looking at what barriers might be occurring so that we can give some resources to help people address that so we can all be as whole as possible at this time. So I will end with a quote as well. And this says, caregiving often causes us to lean in with love we didn't know possible. And I think that that is very true. And Tia Walter shared that quote. So thank you again, Pete. Thank you for our participants. We look forward to keeping this conversation and the focus on caregivers. We know that so many of us are in that situation, have been, and will be. So thank you very much, and I hope everyone has a good rest of the day. Thank you.
Thank you.